Hello everyone, I hope you all are doing good. Welcome back to Module 8, Motivation, Crisis and First Aid for Mental Health. Now we are commencing Lecture 6 of this module, which is about the crisis management. Basically the topic is Crisis Management Skills for Mental Health Professionals. Before we get started, I would like to introduce myself. I am Akanksha Avasthi, a registered clinical psychologist. I have been working here at IIT Kanpur at its Institute Counseling Service for past several years. These are the topics to be discussed in today's presentation. The first is introduction of the primary components, crisis management skills for mental health professionals, decision making during mental health emergencies, managing emotional and behavioral crises in diverse populations, and how to do the collaboration between multidisciplinary teams for effective crisis intervention. First, we will know what crisis is. A crisis can be any emotional, behavioral, psychological situation which is impacting the human being. It can be accident, it can be emotional abuse, it can be failure in the exam, it can be any natural disaster. So, any such calamity, any such emotional thing which is affecting the individual comes under the crisis. A crisis is a perception or experience of an event or situation as an intolerable difficulty that exceeds the person's current resources and coping mechanism. What are the types of crisis? Situational crisis, developmental crisis, traumatic crisis and psychiatric crisis, for example mental illnesses. How to do the crisis management? The crisis management involves multiple things. Crisis management is assessing the situation, assessing the problem, then doing the decision making, involving the client into that decision making process and refer the client to the higher authorities or to right professionals if required. Crisis intervention is also a part of crisis management, which is a short term, immediate and focuses on restoring the individual to their baseline level of functioning or better. In the crisis management, these 5 things comes: rapid assessment of safety or risk, emotional stabilization of the client or individual, immediate support and reassurance, connecting to professional resources and follow-up care to prevent recurrence of same crisis. Now comes to the point, who are mental health professionals whom we are aiming this lecture to? Who are the mental health professionals? So basically there are 5 main type of mental health professionals who are dealing with this crisis. The first one is clinical psychologist, cognitive psychologist, forensic psychologist, sports psychologist, industrial psychologist and organizational psychologist. They work in the professional settings like in schools, in many other platforms as well. So clinical psychologists are those psychologists who after their masters they did these specialization trainings in mental hospitals and asylums and they get their degree affiliated from Rehabilitation Council of India. Now the psychiatrists are doctors who after their MBBS they either do MD or DPM in psychiatry. Now comes the psychiatric social worker. They also have their masters in sociology. They do their specialization degree in psychiatric social work. Psychiatric nurse also come into the mental health professional category. So these are the basic mental health professionals which we will talk about in the future slides. Crisis management skills for mental health professional and why it is important. So it is very important to understand that mental health professionals in their day-to-day life they deal with crisis. The crisis can be psychiatric, the crisis can be organizational, the crisis can be emotional. So they should be equipped with the techniques how to deal with this crisis, how to take decision making promptly, how to assess the situation and how to refer the client to the other required authorities. The very first thing which needs in the adaptive crisis management skill is rapid assessment and triage, de-escalation techniques and key practical strategies. So rapid assessment and triage means the person or the mental health professional they use structured tools like SAFER R, which means first stabilize the client, acknowledge their problem, facilitate the understanding, oh I understand that it is very devastating, you must be feeling sad, encouraging the coping pattern they are having and then referring. professionals can very quickly identify risk levels and they can decide the instant actions. De-escalation techniques means it's a mixture of verbal and non-verbal communication strategies which are designed to reduce agitation and violence. The very first thing is providing the active listening, provide the emotional validation, maintaining a safe distance between the client and therapist, because sometime during the crisis the client is very much agitated, he is not in the condition, he is not trusting anyone. Then your body language should be very open. You should provide the non-verbal communication skill to make them understand that you are listening to them. You can also use reassurance, you can also use paraphrasing. Also, there should be setting limits and offering choices. In that situation also, it is important to provide the choices whether we can talk here or we want to go to some other safer place where we can discuss things in a better manner. So, you are providing the choice to the client. What is bothering you most at that time? You are asking them, you are offering them support, but taking care of their self-respect as well. Trauma-informed care is very important because it involves realizing the prevalence of trauma, recognizing how it affects people, responding appropriately and actively avoiding re-traumatization. For example, if a person who is already going through a mental health crisis, if he or she is going through another emotional abuse, there are very high chances that his coping will be very maladaptive, he won't trust others, and it can again trigger the trauma. If someone is going through childhood trauma or sexual abuse in their past, in their childhood, if the person is again having marital disputes, this can re-trigger the trauma which he or she has gone through in the past. It also prevents re-triggering of the trauma like shouting, physical restraint and escalation of emotional distress. When the whole team of mental health professionals are aware of the trauma the person is going through, the paramedics, the doctors, the other technicians, they all are informed about this thing, and with the proper understanding, they try to support maximum to the client or in the individual. What is cultural competence? So, it is very important to take the cultural sensitivity in mind while you are doing the crisis management. Sometimes because the person is coming from a different nationality, he is belonging to a particular religion, or the person is coming from a different age group, it is important to understand how the belief system and values of those particular person if you are making a plan for the crisis intervention. Now comes the decision making during mental health emergencies. Decision making is a very important step of crisis management, because when the professional assess the scenario, he make the decision which should be correct and which should be prompt as well, because if you are delaying in the decision making, sometime it does the damage in more way. So, what are the steps of decision making process? The very first is identifying the problem. First, what the problem is, diagnosing the problem, make a proper diagnosis what the problem is. The correct diagnosis is very important. The third is discover alternatives. What can be the probable alternatives which can help the client. The fourth one is evaluate alternatives, which one will be better or which one will be the best suitable for the client, for the individual. After the best alternative selection, we come to the implementation, and after the implementation comes the follow-up part. So, how decision making process done? Since we all know this crisis, even the mental health professionals are also under pressure. They are also human beings. Sometimes they also have very less sleep, sometimes they are also tired, sometimes they are also having things going on in their life. Despite having those things, they have to take a decision making in a very prompt and correct manner during crisis. So, what are the three frameworks which work in the decision making process? I will discuss with you. The first thing is naturalistic decision making, which we call NDM. The second one is cognitive load and stress management, and the third one is shared decision making, which is SDM. So, what happens in naturalistic decision making? Naturalistic decision making talks about how expert clinicians make very quick diagnosis within a very short frame of time, just by listening to the client for 5 minutes, And a very trained psychiatrist with a very good experience, when they meet a person who is telling about his mental health issues, the symptomology, maybe within 3 or 4 minutes they can make a very correct diagnosis. So they don't have to go through the screening tools, they don't have to go to the guidebooks, but with their experience they make the diagnosis. So that is known as NDM. Usually what happens, by using their experience, intuition and pattern recognition, these professionals make decisions in a very complex and real world settings. So what are the key points in making NDM? It is usually best when the time is short and the environment is unpredictable. We have no much time to make proper assessment and the decision maker has a very extensive amount of experience. The second one is cognitive load and stress management. During emergency situations like natural disasters, social abuse or emotional abuse, the scenario is very chaotic. There are noises around, people are crying, there are very less resources available to the social workers or other professionals as well. How in that situation, taking care of their mental calmness, taking care of their expertise, they make decision making. Sometimes this decision making get impacted by the cognitive load and stress management. So it is very important for mental health professional to take care of their cognitive load and stress in the mind. Solutions. To take care of these two issues, we prefer doing checklists, flowcharts and decision trees, which are quite helpful for professionals. They are similar to a pilot's checklist for mental health. The checklist ensures the professional covers every risk factor without forgetting key points. For example, in NDM, sometimes we can miss few points if the professional or mental health expert doesn't have extensive amount of experience. Sometimes what happens, they can miss something. The girl who is crying, the girl who is agitated, the one who is like having a very strong pain or injury, sometimes we miss whether the person is having suicidal ideation or not. So if we go through the routine checklist, there are very high chances that we won't miss any important factor which should be considered in the time management plan. Shared decision making. This means involving the individual into the decision making process. This is a very important part and it also shows that client or individual is also having a part, a role, a say in the crisis management plan. So it is very important. Sometimes when we do the decision making, it is important to consider the clients or individuals' choices as well, what they also want, how they want their recovery to be, what are their chief goals and what things are in more aligned with their values and life scenarios. For example, a student who is studying in a good academic institute, maybe he is having a episode of mania and he is having a diagnosis of bipolar affective disorder. So rather than sending the student back home, it's good to do certain aspects which can involve his saying as well. He can be provided academic mentoring. If he thinks the subject is too complex, he is not able to understand, we can provide him tutors, counseling, and also we can reduce the exam load so that he can cope up with the same course in a much better way. Patients who feel heard and respected are more likely to trust professionals and follow through with care. So it is also important when you involve the client into the decision making process, the adherence towards the psychological or medical treatment also increase. They follow up and they also follow whatever instructions have been given in the sessions. Managing emotional and behavioral crisis in diverse populations. So you should understand that in the crisis we can have many diverse populations, LGBTQ community, a person from a very particular nationality, a person from a particular age group, a person from a particular religion. They can have a very different kind of mindset and one proper solution can't be fit to everyone. So there should be some customized crisis management plan which can be sensitive towards the diverse populations. Mental health crisis can present in different way across cultural, language and demographic groups. Effective intervention requires culturally responsive interventions, flexible communication strategies and trauma-informed and equity-focused care. What we mean by culturally responsive interventions. A person coming, maybe for example coming from a Muslim background, maybe he or she is not very comfortable for touching behavior, maybe she feel calm after doing the prayer, so we can be sensitive towards his or her religious sentiments as well. So the cultural beliefs, values and coping patterns should be considered and tailor made according to the person's belief system and their nationality. And sometimes when we choose those kind of coping strategies which are aligned to their cultural sensitive values, they get more benefited by the intervention program. Flexible communication strategies. Sometimes there is miscommunication because the person can be from a different linguistic group. So at those point of time, what is important is to take care of the person's linguistic acknowledgement. It is very important to know what language person knows. It is also to be taken care of that rather than taking family in the loop, it's better to use translators because this will promote the confidentiality. It's also very important that after the communication, the therapist, the mental health professional can ask to the individual, please tell me what you understand by what I told to you. In that way, there will be very clear communication. Don't use very technical term or jargons, use very simple language and first assess whether the person is able to understand your language or not. Trauma informed and equity focused care. It is very important to understand that the care should be trauma informed. The person should know what trauma, the individual is going through. If you are well trained, well informed about the trauma, this will reduce the further trauma and you can act according to the person's trauma and you can take care of those things. Like for example, if person is already having poverty, migration or racism or violence, there are high chances they won't trust you. There are trust issues. So if you already know about their background, it's easier for you to make a crisis intervention plan which will be taking care of these issues as well. Collaborating with multidisciplinary teams for crisis intervention. Now, this is something which is very significant in the crisis management plan, that the whole team of crisis management, a team of mental health professionals, they should be from a different expertise. There can be a psychiatrist who is expert in the field of medical. There can be a clinical psychologist who is expert of making diagnosis, assessment and providing therapy. There should be a psychiatric social worker who is knowing about all the sociographic, all the family issues, all those issues which are affecting and contributing to their problem. There can be a psychiatric nurse who can assist the psychiatrist and also provide the medicational and therapeutic care as assigned by therapists and psychiatrists. So basically, mental health crises often require coordination among professionals such as clinical psychologists, psychiatrist, psychiatric nurse, social worker, EMT and security officials. Clear collaboration reduces risk and increase results. What happens if we have very clear communication? The first thing is each team member knows their role and what they need to do. Who will contact to the authorities, who will stabilize the client, who will talk to the family and who will do the management psychiatric part, who will take care of the medicine part, who will take care of the transportation part. Everything is clearly defined who will do which part. By doing this thing, there will be very prompt decision making and no delay in getting the resources. Regular team briefing. It's very important, like for example, critical incident stress debriefing. Like in a psychiatric ward, if incident in which the patient had a very strong anger outrage or anger outburst, so after that particular incident, the whole team can meet for a small debriefing meet so that they can discuss what went wrong, what triggered the situation, what are the things which we can follow up so that this thing won't happen in the future, and what can be the safety mechanism. These all things can be discussed in these regular team debriefing. shared protocols and planning. A crisis intervention team is also having very strict protocols, and they know when and whom to call and communicate. For example, at higher educational institutes, if there is a suicidal ideation, the whole team knows who will contact the warden, who will contact the family, who will contact and collaborate between the psychiatrist, who will contact the security officials, who will inform the faculty team members. It means the protocol is very clear, and this delay the crisis intervention part, because when everyone is clear about their part, they do it and there will be no confusion and there will be no delay. A crisis intervention team, officers use verbal de-escalation, clinicians conduct assessment, hospital transport is coordinated calmly without any force, because they all know their protocol and accordingly they work. Family and community involvement. Yes, family and community involvement is very important in the crisis intervention plan, because when we involve the family, we provide extra support to the client. For example, if a client who is having very chronic psychiatric illness or any kind of physical illness, rather than sending home, it's better to make that person day scholar and provide the parental supervision, so that their medicines, their other things can be taken care of. In that way, the client is getting support from the family, there is family involvement, and also they are getting the professional support. It is very helpful for the follow up, because sometimes without the parental supervision, follow up doesn't happen. So family and community involvement is very important. For example, in the case of emotional abuse also, if we involve the family, the social support, it is usually very beneficial. So these are the resources which you will go through to get the better understanding, and thank you.